morning all of you. My name is Megha Kavar. I am lecturer at Regional College of Pharmacy. Today we are going to study D.Pharm's part 1 subject, that is social pharmacy, and its unit number 2, and the topic is mother and child health. Okay, so what does it mean by the term mother and child health? It states us about the health of a mother who just gave birth to her baby and the baby's health. Okay. So what we can conclude with this term mother and child health? We conclude, or we can say that if mother will be healthy, then simultaneously the child's health will be at a good aspects. Okay. So there are some aspects that do affect health of mother and child both. Okay. First, we will talk about the topic that is importance of breastfeeding. Importance of breastfeeding. There are a lot of importance of breastfeeding, a number of importance that do a crucial role in child's health or his or her overall lifespan. Okay. So, if child receives her mother's milk, that is breastfeeding, then he or she may lack obesity, because breast milk contain vitamin, minerals, a lot of proteins, okay, and it is packed with disease fighting substance that protect the baby from illness. Okay, the breast milk is packed with vitamin, minerals, protein, etc. that do help in child's growth, and disease fighting substance, that is antibodies. Okay, there are two terms we use, antigen and antibody. We use two terms, antigen and antibody. Okay, these are the two terms. First of all, what is antigen and what is antibody? Antigens are the foreign particles, foreign molecules, foreign microbes that do affect health of a person. Okay, antibodies are present outside the body, that is why they are called as foreign matters. That is why antigen is known as foreign matters. But in the same place as we talk about antibodies, okay? Antibodies are the substance that do provide immunity to the person. What is immunity? As we talk, antibody provide immunity. It provides immunity. What is immunity? Immunity is the capability of a person's inner strength to fight against that foreign matters, that foreign microbes, and prevent the body to create a new disease or any new discomfortness in the body. Okay, so we come again to the point. We was on the importance of breastfeeding. So the breastfeeding milk also contain antigens, and these antigens are also known as disease fighting substance. They are also known as disease disease fighting substance. Okay. So the more milk a child gets, the more immunity will be strong. What about the minimum time period that a child can get his breastfeeding done? The minimum time period, or we can say that it is 6 months. The minimum time period for breastfeeding is 6 months. This is the time period in which a child should and have to receive the first milk of his mother. Okay, so there is a particular term that we use for the first milk of the mother, that is colostrum. This is the first milk of the mother. It contains vitamin, protein, minerals, disease fighting substance, antibodies. Okay, which antibody does colostrum contain? It contains. Okay, there are a lot of IG with the immunoglobulins. What was the full form of IG? Okay, so we was talking about the importance of breastfeeding of the milk first 6 months. Okay, then let's move to the next topic, that is beneficial for baby. Why the breastfeeding is beneficial for baby? Okay, now we will get some points. That points will tell us the beneficialness of the colostrum for a child. Okay. After having that breastfeeding milk, a child's capability of disease fighting increase. Okay, as the capability of disease fighting increase, the child will less often occur to a new diseases. Okay, a new child or a baby often face some sort of diseases that like respiratory diseases, respiratory syndromes, or GIT disturbance and all. Okay, if he or she get breastfed milk at a time, then he or she should not have to face this kind of diseases. Okay, second one is allergies. What is allergy? Allergy is caused due to interaction of antigen. Okay, due to interaction of antigen, allergy is caused to a person. Okay, if at the starting stage, that is his or her child stage, that is you are talking about the 6 months. Okay, that 6 months stage, if a child is given a lot of antibodies that will help him throughout the lifespan. Okay, then he or she will develop a great immune system. Okay, and if a great immune system has been developed inside the body, then there will be less chances to create or to get affected by the antigens. Okay, if a person is not get affected easily with the antigens, then they are less probability of getting allergies. Okay, so that was the whole cycle. If child drink breastfed milk, then antibodies or then immunity will be developed in him. If immunity will develop, then they will give like a good coalition to the antigens. Okay, and if they can fight against antigen, then there will be no point of raising this, then the person will get affected from the diseases or allergies. Okay, now move on to the intelligence. What is intelligence? Intelligence is the capability of person to solve things easily without hesitating, with a calm mind. That can be called as intelligence, normally normal words. If a child is getting whatever they need from their starting stage, there is a breastfed milk, because I already mentioned it, that breastfed milk contains vitamin, minerals, protein, disease fighting substance and all. Then the brain capacity of working. Like for example, we can get it from an example like when we get gear oil to cars. Okay, then when we get gear oils to car, it can lubricate and it will work smoothly. Okay, if it will work smoothly. Likewise, if the brain will get its nutrition at that slow age, at a low age, then the brain will get its lubricant, and after getting that, the brain will work very fastly and with less complications. Okay, so for the proper working of brain, for effortless working of brain, breast milk is important for children. Last but not the least, obesity. What is obesity? Obesity means overeating. A person's hunger cannot be satisfied. Okay, that is obesity. A person continuously eat whatever stuff he or she get. Okay, like for after 10 minutes or 20 minutes, after 1 hour, they must eat. They must have something to eat. Okay, so if a child is get breastfed, okay, then his or her hunger will be stopped at a time. Okay, let me make you clear this first. If a child is breastfed, then his hunger will be stopped at a one point, and then after 5 to 6 hours he will get again breastfed. Okay, like this, his intensity of his frequency of eating or stopping his hunger will start at an early age. Okay, if he is not breastfed, then if he feed it from the bottle, then after 2 minutes, after 10 minutes, again and again, sometimes he or she gets only 2 drops, 5 drops, 10 drops, like this, his hunger will not stop at a point. It will only rapidly increase. Okay, so if this will done, then a person will have chances to grow obesity, and if there will be obesity, then the person will have to face weight gain and abnormal physical activities. He or she will not be able to do as much as physical activity as a non-obesity person can do. Okay, so these are the some beneficial effects for baby. Then, okay, thank you so much.